everyone. Welcome to Round Robin. I'm your host, Robin McCormick with the City of Hampton. And today we are going to talk with the president of Sentara Careplex Hospital, which is not just a Hampton hospital, but a regional influencer now and serves the entire region. So meet Kapua Conley. Welcome.
Well, thank you. Thank you for inviting me. Appreciate the invite.
Well, you know, it's a major institution in Hampton, and we like to watch the growth of Sentara and keep up with what's going on at the Careplex Hospital. But first, I want to talk about you a little bit.
Okay.
You've been in the region for around a year now.
Right.
And so how did you end up here? You have been in hospital administration forever?
No, actually, I started my career in IT. I had graduated college, and like a lot of us, when we were leaving college, we wanted to kind of be part of the dot-com boom and get rich really quick. So I had jumped into the IT world, kind of migrated from being kind of a developer slash somewhat of a network engineer, and then kind of moved into kind of cybersecurity, and then more into the process improvement world. And so that was
big and growing fields, I would think.
Well, at the time, you know, you got to realize you're thinking the internet now. I'm dating myself a little bit, but the internet that I jumped into was kind of a static page, and you still had telephone wires connecting into your computer. So it was a very different time. But I kind of wanted to kind of be in that cutting edge. And honestly, to be honest with you, I wanted to make money. And that's kind of, you know, like every kid in debt coming out of college wanted to make some money. And so that was kind of my path. But then I'd say probably 5 or 6 years into the career, I was diagnosed with cancer. And so I fought cancer, went through that whole process, and kind of had kind of a changing of minds, you know, more heart than anything. I realized that success isn't really measured in dollars, but lives that you touch. And so while I was going through that process, I realized that healthcare could probably benefit from individuals' more process improvement, process engineering background. And so once I got in remission, I gave my job my 2 weeks, and I went back to school to Tulane. That's where I did my undergrad and did my graduate work there, and the rest is history.
That takes nerve. Yeah, I mean, wow.
It was a bit nerve-wracking, but at the end of the day, you know, you kind of when it feels right, just kind of do what it takes.
So then you got a master's in?
I got a master's in healthcare administration from Tulane. And kind of how things work, it's kind of funny how things kind of fall in line. I got into healthcare because of my cancer background. And then probably like 2 years into my training, I got a job offer from MD Anderson Cancer Center, the #1 cancer center in the country.
Oh, wow.
So I took that opportunity as administrative fellow. So didn't really jump in the workforce right away. I spent another year or two getting coffee, learning the ropes, kind of being a trainee, kind of an intern, not just an intern, kind of an apprenticeship role. And then my diagnosis was testicular cancer. And then when I had an opportunity to take a job with MD Anderson Cancer Center, they put me in the same area where my diagnosis was.
Wow.
So I ran the genital urinary center, outpatient center for MD Anderson for a couple of years. Did that for a while, and then really wanted to kind of jump out of the specialty-based healthcare and wanted to be more community-based, and jumped into work for a company called Community Health Systems for a while, and then traveled the country more on the West Coast, running hospitals and helping communities there.
So then you ended up here.
Right.
And how have things gone your first year? I mean, to me, this was really, and it probably wasn't to those of you who've been on the inside working at Sentara, but it was the year that the Hampton Hospital kind of made the big leagues for the first time, the U.S. News and World Report, and you know, it's become a much more regional facility.
Yeah. So you know, it's really a journey. You know, you don't get there overnight, and it's a testament to all the people that work at Careplex and all the providers, the physicians that work there. Careplex is, if a lot of people don't know this, Careplex is part of Sentara. And Sentara Health is actually the largest non-for-profit, largest healthcare system in Virginia. And I think the team at Careplex really leveraged that relationship and those resources. And so, you know, with those resources come physician practices, home health support, SNF support, skilled nursing facility support, and just a lot of caveat, a lot of cadre of other different kind of healthcare support systems. But we really leverage that support to kind of really focus and go down the journey of patient experience and quality safety. And so I think Careplex has been down this journey for several years. And I think recently we're starting to get accolades and awards for that path. But I think Careplex has always been focused on patient safety and patient experience. And so we're proud of it. It just shows us that we're doing the right things. But at the end of the day, I think we continue to push the envelope on increasing patient experience and patient safety. So.
And that's sort of the bread and butter. But one of the things that I think helped make it more regional is the orthopedic center.
Yeah.
I mean, that is obviously your predecessors made that big investment, but it has grown truly into a regional center. Why is that important?
Yeah. I think for us, it's a true partnership. We have an exclusive partner with Tidewater Orthopedic Associates, TOA we call them for short. And I think when you have that kind of partnership, you can kind of, you're not hurting cats. You're just dealing with one group and one single vision. And so with that group, we've been able to really focus in on, what is the future of orthopedics? We see orthopedics not necessarily as much in the hospital in the future, but really moving into the outpatient environment. But even saying that, now we see our patients leaving within 24 to 40 hours from the hospital, and there's a regimented program. You do a lot of pre-work before you have your orthopedic surgery. You do a lot of post-work with rehab, and it's really complete alignment. There's a lot going on. There's a lot of moving pieces, but with the combination of orthopedics, rehab, patient education, we've seen our outcomes improve year after year. And what typically would have you in the hospital for 3 or 4 days, people are up and ambulating in 24 hours now, and you're back home where you should be.
And that's amazing.
It's phenomenal, and that goes to show that that's that partnership that we have with Tidewater Orthopedic Associates, and just the collaboration with the team in general.
And I would think some of that is, recovering from an injury or a break or whatever, but a lot of it is probably joint replacement or joint, because as baby boomers age, that seems to be, a real challenge for a lot of folks.
Most of our orthopedic work is related to joint replacement. We'll have the occasional breaks in the emergency room, and the team does a great job with that, but a lot of it is just joint replacement. And that, we have a lot of joints. And and we're living longer, and the joints need some work. Absolutely.
Well, what are the other areas of excellence or areas of regional focus that you all have?
I think we're starting to become more regional when it comes to cardiac services.
That rated very highly, actually, on U.S. News. I noticed that, and I was a little surprised because I thought, well, the heart people are, they go to Norfolk, but not everybody.
Well, I think what you'll see is the trend of, we have support of the Heart Hospital, and that's one of the top 10, I believe, one of the top 10 heart hospitals in the entire country. And so because of that relationship, we do have the access to that expertise. And there is a growing trend to move away from kind of the hub and move out into the community. And what you're seeing from us is that kind of relationship starting to come to fruition, where we're bringing more services to the community, where not everything has to go down to the heart hospital, and we can do more regional stuff here in Hampton. And so what we're seeing is strong collaboration with our cardiac rehab, with our physicians. Dr. Ridley is a local physician, well known. We have Dr. DeLacy, Dr. Rosada. So these physicians are all part of that kind of Sentara Heart Hospital umbrella and affiliations. And so, again, I get back to it. It's really about moving away from the hub and kind of get out into more community-based regional medicine. So.
Well, and I noticed too, I think that whatever the statistic I looked at was the recovery from heart attacks. If people got there, it was an extremely high recovery rate. But some of that, again, community-based medicine is on the prevention side, on the, on the treatment side, and keeping. Right.
I think, a lot of the success that we've had on the cardiac side is our cardiac rehab. We have a very strong cardiac rehab program. So, when you're done with the acute episode, the reality is, how do we get you back to how you were functioning before your episode, and then how do we prevent it from happening again? And so we have a very robust cardiac rehab program. I feel like we should probably market it a little bit more. We have some very dedicated nurses and individuals just focused on trying to get people back to their quality of life before they had their episode.
Huge, important thing. And then, of course, you have all of the normal hospital services as well. So. Anything else? I know, in Hampton, we were very excited when the obstetrics came back to the hospital.
Well, it's funny because the first thing Mayor Tuck said to me is, babies can now have Hampton birth certificates. And, and being new to the community last year, I didn't realize how important it was. And as I made rounds in the community, I would say it's probably the top 5 things out of people's mouths are just, we're having babies in Hampton again. And I think it's the right thing. We have a very a thriving population, and those obstetric services are kind of needed. So, I'm proud to say that, we can take care of the babies all the way down to the elderly adults now from a women's health perspective. And that was a large gap that we were missing. And so, it's back, and we had our first year anniversary in January, and we plan to keep expanding it. We're working with partnering groups right now to develop a midwifery program that's focused on midwifery. A lot of people in the community look at midwives as just physician extenders, but there's a growing population that want to be seen by midwives, but with the relative support of a physician if needed.
See, that's the perfect combination, I think, because in theory, at least, this is the process thing, but you're treated by the person who is closest to the situation, who has the right amount of training, but there's the backup if something goes wrong or if there's a complication or all those things. That's great.
When we opened up the obstetrics unit, we did a market survey, and there was a growing need or a growing want for mothers to be followed by midwives. Many people now in other states are entering the system being seen by a midwife and being delivered by a midwife for normal deliveries. It's a different slant, right? They have a stronger nursing background. They tend to spend more time with the patients.
Right.
They work in groups. Midwifery programs have more kind of a group setting. So instead of spending maybe 30 minutes with your OBGYN, you're spending 2 hours with a group of 4 women or 5 women talking about things like nutrition, things like postpartum depression, what to expect when you deliver. So I think it's a lot more hands-on, intimate kind of a relationship when you're dealing with midwives.
It's interesting because it treats it not just as a medical condition, but as a stage of life.
Yes.
And wellness is part of the emphasis.
They definitely focus on that. And so, the drawback with midwives are what if something happens, right?
Right.
Well, we have 2 partner groups that say, listen, we want to kind of focus on midwives, but we also want to make sure the community knows that we have OBGYNs in the back in case this normal delivery becomes complicated.
It's the perfect combination.
Like you said, the best of both worlds.
Yeah. Okay, so look in your crystal ball.
Okay.
And tell me, if you're allowed to, where you might be going next. What new expansions or areas of focus do you think you'll have?
Well, I think I just want to let everyone in the community know that I live in Hampton. So when we talk about the community, I'm selfishly, these people are my neighbors. I see these people all the time when I go to Food Lion, and so I have a vested interest in seeing healthcare grow in this community. I think what we're seeing over the course of time with healthcare is less focus on the episode and more focus on the quality and health of the population. And so, things that we'll be working on with Sentara and with Careplex is focusing on those social disparities, on what actually created whatever your chronic illness is or whatever your illness is. In some of the cases, it started 20 years ago when you deep fried the Twinkie, right?
Right.
Or when you started smoking. And so, my focus is really going to be looking at partnering with community non-for-profits on ways we can make the community healthier. It's unfortunate, but they look at places like Careplex to kind of solve the health issue, but the reality is we can only control about 20% of it. The other 80%, the die was cast years ago. And so as we start looking at the wellness and health of the population, we got to start from the beginning and start looking at being more proactive. From an acute standpoint, I think, my job and the team's job is really to kind of close care gaps. If people leave Hampton for health services, I want it to be by choice, not because we don't offer it at Careplex. And so, last year we opened up the obstetrics unit, OBGYN. We're delivering babies. We're enhancing our cardiac services. We're continuing to improve orthopedics. But, I really want to get into the neuroscience world. I want to start working on stroke. I want to expand that program. I want to continue to expand our vascular program. So, as we start looking across the continuum, where are these healthcare gaps? I want to make sure that we're kind of covering them up. And so next year you'll see we'll have an EP cardiologist joining us, Dr. Keel. He starts in July, actually, this year. We have a neurosurgeon starting on the peninsula, Dr. Tina Rodrigue.
Wow.
We just hired Dr. Guy. She's a female breast surgeon. So we're trying to do the best we can to make sure that the people of the region, specifically people of Hampton, don't necessarily have to leave Hampton for their healthcare needs.
That's great. And obviously you do have some oncology services.
Yes.
Do you think that's an expanding area, or?
Yeah, so I think oncology is kind of, looking at the statistics in Hampton, that's one of the biggest attributors to premature death is cancer. And that's determined by anyone that dies before they're 65. This is public health data. And so we see definitely expanding oncology services. We have a partner in VOA that helps us on our medical oncology side. But we brought in Dr. Azab and Dr. Guy. Dr. Azab does complex surgical oncology, and like I said earlier, Dr. Guy does breast surgery. We've expanded our radiation oncology unit. We have now a LINAC that does SRS treatments. And so
I don't understand what that is. You might have to explain that.
I'm sorry. So it's an expansion of radiation oncology. So we've enhanced our equipment, in other words. And so what we see is that is a major opportunity. And so we'll continue to focus on breast cancer. Now that we have a new neurosurgeon coming, we'll focus on those cancers related to that specialty. So I definitely see that as an opportunity.
Okay.
Yeah.
Well, is there anything you want to add before we close?
I will tell you that I'm extremely grateful to be living in Hampton. My family, we moved cross country from San Diego. And we're enjoying every minute of it. So everyone in the community has been so open, have welcomed us with open arms. Everyone has been, I guess, the quintessential. We've experienced Southern hospitality, so we love it. Thank you very much.
Thank you.
All right, thank you. Thank you.
Thank you for watching. There is so much more to Sentara Careplex Hospital than most of us see from the outside. We do see it when we're patients or when we're visiting people, but there's a lot going on at this institution that is important both to Hampton and to the entire region. Thanks for watching.